on the interpretation channel. And this meeting is also being recorded, so we have this available on our website if people weren't able to attend. And I held this meeting today so we can talk about what we see as changing in the new fiscal year, which started on July 1st. And mostly this will be an update on the state budget as it relates to the Developmental Disability Services System, but we'll talk about a few other areas where there are also changes that may be important to you. Before we start, I just wanted to give an update on COVID-19 and vaccines in our community. In July, we have seen an uptick in cases of COVID-19. Most of these cases are among people who are not vaccinated. We have seen a few in people who are vaccinated and fully vaccinated. So I think you'll see in the media that many counties are now advising that all people who are interacting indoors do wear face coverings. Again, that's back to that advice. But what we are seeing is that most of the serious cases are in people who remain unvaccinated. And so pushing for vaccinations, making sure that everyone is vaccinated is one of the most important ways that we can keep everyone safe.
Que todos los que puedan vacunarse se vacunen.
These are some of the contacts for how people can get vaccinated and schedule those appointments. And that's for anyone who needs to be vaccinated at this point. So I wanted to start with the state budget. And every year, the state budget is passed sometime in the month of June and signed into law by the governor to take effect on July 1st. And during the month of June, there was a lot of negotiation going on in Sacramento that ended up with a budget bill being passed and a number of trailer bills with policy decisions related to regional center services as well as service systems. The budget bill lays out the dollars. The trailer bills lay out more details about policy, and they come after the budget bill, but they are part of implementing the budget. There are also a few additional items related to our service system in an American Rescue Plan request to the federal government, and we'll talk about that a little later. The first important thing is that self-determination is no longer a pilot. Those who are status 2 Landerman eligible are now able to select self-determination. It's no longer limited to those selectees that were chosen over the last 2 or 3 years. Please, if you're interested in self-determination, check our website for information on orientations and let your case manager know of your interest. The budget includes some additional funds to help people move into self-determination to support the regional center to move people into self-determination. It also establishes an office of the ombudsperson specifically for self-determination when people are having challenges. The second important thing that is included in this year's budget is a 5-year phase-in of rate reforms to achieve the rate levels in the 2019 rate study. This is for service providers, and as you recall, the rate study looked at increasing rates to reflect the cost of labor in geographic areas. And we do expect that this phase-in will include, over time, looking at the higher cost of living in our area and addressing that in terms of the rates that are set for service provision. There will also be, after the first rates are increased in April of 2022, future rate increases are also going to include that providers meet certain quality benchmarks and that there be metrics and outcomes reported on to achieve person-centered service delivery. And more on that as we move forward in this year. In the budget, one thing we wanted to see in the budget as regional centers was the ability to hire more service coordinators and bring our service coordination ratios more into line with the requirements in the law. However, we didn't get that for this fiscal year. We do have a promise of funding to enhance service coordination to bring it to the required levels in the law starting July of 2022. And there is also language that's directing the Department of Developmental Services to meet with stakeholders and to make recommendations for the development of standard performance improvement indicators and benchmarks to incentivize regional center operations and to provide incentives for improvements in performance at regional centers. The budget establishes a small number of 1 to 40 caseloads, which that would be one case manager for every 40 individuals served. And this intensive caseload ratio is designed to improve service delivery to people who are in underserved communities. And these caseloads will be designed to target those people who have very low or no purchase of service. And that will be used as the way to identify who will be on these caseloads. They will work on making sure that people have the right regional center services in place, as well as to looking at other access issues to other community-based generic services that might be helpful. And we expect that we will have about 5 of these positions at Regional Center of the East Bay, and we'll share more information about that as we move forward. It won't be everyone who fits in this category, and it'll involve a little bit more direct contact with case managers over a period of time. There's also a new eligibility category that's been established in the law. And this is for 3 and 4-year-olds. And this would allow children who do not have a diagnosis of a developmental disability and only have limitations in 2 areas of functioning to be eligible up until their 5th birthday for Lanterman services. Sometimes there's a little misunderstanding about this. It is not an extension of Early Start. It is allowing these children to be eligible for ongoing regional center services, things like respite, specialized childcare, specialized equipment, and those things. And there will be reevaluation at the age of 5. The kind of educational services that are provided in the Early Start program wouldn't be part of this. Rather, there would be a case manager available to help people link with the school district and make sure people are getting the right services in that arena. The next thing is something that both people served and families and regional centers have been advocating for a long time. During the Great Recession, which was 2008 and on, social recreation, camping, educational services, and non-medical therapies were eliminated for almost all individuals served by regional centers. We had policies prior to that time to purchase these services when it was something that would meet goals and objectives in the IPP. And those policies were actually put on hold during that period of time. We also had providers who provided some social recreational activities for individuals and some non-medical therapies. Most of those providers have not been providing services over the last few years, but we are now able to provide those services. And as those services out of hibernation, as I'll call it. They will be available, and we will be working with case managers to actually train them on the new purchase of service policies around these services now as we move forward. So that's exciting, and I think people will be quite excited to be able to get these services again. The budget also, in addition to some provider rate reform, it also allows for additional wages for direct service professionals who have received certain training and have certified that they did that training, as well as those who are certified as being bilingual. This will be a wage supplement to the individual employee, and it won't be part of the rate for the provider per se. It will be tied to each individual employee who meets these qualifications. And the implementation still isn't completely clear to us, but wanted to let you know about that. We do have many people who are looking for providers who speak their family language, and it would be very important to have providers and direct service professionals who can provide services in people's language. There is funding for implicit bias training for regional center staff. This started as a proposal in the May revision of the governor's budget to only include staff working in the eligibility arena, but it has actually expanded to include all regional center staff as well as service providers. And this will be something that we will get more information on as the Department of Developmental Services starts to implement this in conjunction with regional centers. There has been language in the state budget for many years that has basically taken provider increases that happened over the last few years, including an 8.2% increase that happened in the beginning of 2020. And it allows for that rate increase. It allowed for that rate increase to end as of a December 31st date, I think of 2020 and 2021. There was also language that restored the ability of providers to follow their own holiday schedule and not have to follow a mandated state holiday schedule. In other systems, such as in-home support services, hours every year had to be reviewed as to whether some decreases in hours would be applied for IHSS. This year, the legislature identified that many of these suspensions of different increases and volumes of service were really focused on social service and healthcare systems, and that this was wrong. And this year, language on suspension terms for these services has been eliminated across the state services, and we will not see that again as a regular matter of course for services. So that's exciting. I mean, it was a little bit uncertain for providers to have had an 8.2% increase and then feel like every year it was sort of not certain whether it would continue. And that impacted some service delivery, people's ability to hire and assure that there would be stability. The other thing that is in some trailer bill language is the ability to continue some remote services, virtual meetings, and early start services conducted remotely through the fiscal year without additional directives from DDS. There are still directives from DDS that come out monthly that allow us to continue virtual meetings for IPPs and so forth at this point in time, but we do expect at some point those will end, but this allows it to continue for early start through the fiscal year. Another program. And let me say, this year's budget contains a lot of spending and a lot of new programs and policy changes, which is really exciting. And we're going to have to all do a lot of work together to make sure these projects and programs are really get in place and are what people want and need. At the Family Resource Centers, which have served our infant and young children's families for many years in our community, DDS is going to fund additional services there, which will be a community navigators project, and it will be in 21 family resource centers. And should serve all geographic areas in California. And it's intended to provide additional outreach and support for families of children who are navigating the service system. And as we look at this being developed, it looks like it will really focus on families who have difficulties with navigating the service system, and maybe have language barriers and other social barriers to accessing services. And so while this isn't at the regional centers, it is funded by DDS, and we'll work very closely with regional centers as we serve our mutual individuals. Each regional center this year is going to have a position for coordinating and preparing for natural disasters and other emergencies in our community. When we have natural disasters and people are in need of assistance during things like power outages or fires, regional centers do step up and try to assist with connecting people with resources. This position will give us the ability to do that better and to be prepared and to make sure people are prepared in their own homes for these kind of events. Each regional center is also going to have a new position, which will be someone who is specializing in services for people who are deaf. And this is designed to be both a point person for resources and that need to be developed or that we have, as well as to serve as a community liaison to deaf services in our communities. And so this is a new position. It's just going to be designed now, and we look forward to this, especially as we are really trying to develop more resources for the deaf community that are targeted to where they want to live and what kind of supports they want throughout their days. Now, everything I talked about previously are basically investments at the state level that come about through the budget. And in March, I believe it was, the American Rescue Act was passed at the federal level. And the American Rescue Act added some money for states who provide home and community-based services. And most of the services that regional centers provide are considered home and community-based services. So this includes services like respite, independent living skills training, specialized childcare, day services, residential services. If someone is a recipient of Medi-Cal, the state gets reimbursed about 50% on the dollar for those services by the federal government. In the American Rescue Act, there is a provision where states will get an additional 10% of federal dollars for those home and community-based services that are billed for 1 year. And the state is allowed to use these funds for any kind of one-time activities that they might be doing. And some of the funds that the state anticipated having from the American Rescue Act have been included in different things proposed in the and approved in the state budget. There are also some items that are separate from the budget that are in the state's American Rescue Act proposal. The state had a previous proposal for these funds, which was issued early in June. That has been pulled, and instead a new proposal was issued on July 12th and will be submitted to the federal government. That is for those things that specifically will be tied to this funding. And these are a few the things that are tied to regional center supports. One is making sure that orientations and trainings are all translated and are culturally competent. So this is for different orientations and trainings that the department would be responsible for. There's a proposal for a new family support service for people who are living in the family home, where families need assistance with really coordinating their supports in the family home. There is a proposal for some funding for regional centers to work with local community-based organizations and recreational departments to assure that recreational activities in our communities are accessible to children and adolescents with intellectual and developmental disabilities. And while we've always had some of these programs in communities, especially our older communities where they were developed, a lot of programs were developed in the 1960s and 70s. Many newer communities have not developed these resources, and we look forward to seeing these programs developed in all communities so everyone can benefit from these sort of social recreational activities. There is also funding through the American Rescue Act to modernize the technology that's used by the Department of Developmental Services as well as regional centers. Now, that's never a very exciting thing. However, a lot of the data that we need, a lot of the providers we need to pay are really challenged by the antiquated technology that we have. And we are hoping that this will allow us to be more nimble in terms of doing different things with our community and for reaching out to people and having people be able to access information much more quickly so that we can provide better services for people. The other things that are in the budget that impact people served by regional centers, I talked about in-home support services, but that system, the suspension language has been eliminated. There will also be some stipends for in-home support services workers who worked during the pandemic, and as well as additional funding for career pathways for in-home support services workers, which is something that's similar to that training incentives for people who get certain training who are direct service professionals in our system. In special education, there's a number of supports for program enhancements. There is also funding for disrupted education during the pandemic and for the resolution of disputes related to that. And we have heard that many people feel like their education delivered during the pandemic did not meet their needs, and there will be many requests for additional supports as people return to school. Other things that are in the budget that are relevant are continuing full scope Medi-Cal for undocumented children and youth up to age 26, adding full scope Medi-Cal for undocumented income eligible adults who are age 50 and over, maintaining some supplemental funding for pediatric physician and other specialist visits that was there about 5 years ago and always threatened to be eliminated. And this is very good to maintain quality pediatric care in our community. There's extensions of flexibilities for Medi-Cal providers, including paying the same amount for video and telephone telehealth. And in the Medi-Cal system, we have seen a need for some flexibility so people who can't get to appointments are able to access medical professionals via telehealth. And this allows for an extension of that. And it also allows people to be part of advisory groups on what people want in the future in terms of telehealth. And in behavioral health, which impacts many people served in our system, there is quite a bit of funding to create a more targeted mental health system, behavioral health system for children and youth, including $205 million for school and county partnerships for school-based services. It is always a challenge to make sure that people with intellectual and developmental disabilities are served through behavioral health systems when it's appropriate, but having these additional funds is a time when we will also be able to participate in influencing how they are spent. There are also other dollars for expanding community behavioral health treatment and crisis support teams for youth and adults. And that is the end of what I am sharing about what was in the state budget this year. I am happy to take any questions about the budget. Please stay tuned over the next 3 or 4 months as we see more of these things being implemented. We are working on being able to support the provisional eligibility for our young children as they move out of early start, and as well as children who are ages 3 and 4 who are applying, who may not quite fit the Lanterman categories at this point. We are also very interested in getting social recreation services available to people. And as I said, we'll be training our case managers on that, but it will be a little while until those services are up and running as we have moved through the pandemic. So please, if you have any questions, you can raise your hand or put them in the chat. We're going to post this PowerPoint on our website so you can see it. While there's a lot to be done in the next year, it's very exciting. And we're especially excited about next year when we will be able to reduce caseloads for everyone so that people are served in the way they should be served. And there's a question about where is the link for this recording at rcb.org. And we post that on our website, and it is maybe Michi can tell me exactly where that's linked in the chat. So Michi will put in where our links are for that in the chat. Okay. If there's no other questions, we'll leave this link up here, and we will, here's where Michi just put up where you can link to the information that I've presented today. And hopefully you can do that and you can share it with people and attend any community meetings we have so we can get your input on services. So I have a hand raised from an Amy. No, unmute. Do you have a question? Okay. Maybe not. Okay. Are there any other hands raised? Okay. So there is a question in the chat. My son's program is opened, but we're having to provide transport. The reimbursement is way too low. So our rates, when we talk about the rate increases for provider rates, our rates have been frozen for many years and get occasional increases. However, our transportation reimbursement is a fixed rate. I think it's by mileage. We will expect that as the provider rates are increased, that there may be an increase in that rate. We're also hoping that our transportation providers will soon be able to provide more transportation to people. During the pandemic, many of the transportation providers have lost their people who are transporting, and there was also a problem with having to be able to social distance on the vehicles at this point. And so we are working with them, especially in our transportation department, to change a little bit what the spacing has to be on vans. So now they can be 3 feet apart for people. And we are hoping to see that improve over the next few months as more and more people attend program. Yeah. Yes, I agree that the reimbursement is a fixed reimbursement that we do not have control over at this point. I guess that if the only way that there probably could be a little bit of difference is if someone were receiving services in self-determination, where there are some abilities to pay different rates, but that is a different program. Although that is the only way that we are able to reimburse more than what are our current rates. They have been fixed and frozen to what were median rates that we had in 2011. And so those rates are not something we can increase. However, I think one of the things that we see in the rate study and that the provider rate reform is supposed to address is the differences in cost in different areas of the state. And so we're hoping that that will be addressed at that point in time. Okay, I don't see any other questions, so I will close the chat. If you have any other questions that come up as you're thinking about this or looking at the PowerPoint, please use our Write to Us feature, and we will respond to your questions via that feature, so you can get your questions answered. And thank you.